Most vaccines are not 100% effective at preventing symptomatic infections, but if many people get the shots, they could prevent the spread of disease near perfectly anyway.
Lots of numbers are being thrown around touting how effective different vaccines are at preventing symptomatic coronavirus infections. These calculations are based on vaccine trials which have been performed on tens of thousands of volunteer shot takers around the world. But what do these percentages really mean?
The number is an estimate. To reach it, researchers look at all the people in a vaccine trial who get sick during the study period. They then quantify what percentage of them were vaccinated or not.
Both Moderna and Pfizer said that roughly 95% of the people who got sick with COVID-19 during their trials had not received vaccines, while 5% had. That does not mean that a vaccine is going to be 95% effective at stamping out all disease, even the asymptomatic kind. It also does not mean that 5% of vaccinated people globally will get sick. And it also does not mean that once you are fully vaccinated, you have a 5% risk of getting COVID-19.
At best, it provides a temporary snapshot, a vaccine maker's rough estimate as to how well their vaccine will perform at curbing symptomatic infections among the general public based on just a few months' worth of trial data.
In Pfizer's phase 3 vaccine trial, 8 vaccinated people got sick with COVID-19 out of more than 18,000 people who go on both doses of the vaccine.
But Yale immunologist and leading virus expert Akiko Awasaki says there is a terribly misleading way to think about this trial, saying if you were to ensure that 18,000 people all got exposed to the virus, then yes, the vaccine efficacy would be incredible, but they are not. That means even many unvaccinated people in the same study managed to evade the coronavirus, likely through a combination of factors such as the variant exposure risk, the mitigation measures like wearing of face masks and hand washing, and perhaps some immunity from previous infections. So it is more helpful to compare the 8 people who got sick with vaccines to the 162 people who got sick without them at the same time. And that's the better comparison, Awasaki said, and that's where the 95% comes from.
In Moderna's phase 3 coronavirus vaccine trial, 11 people out of nearly 14,000 fully vaccinated individuals got sick, while 183 of the unvaccinated people in a similarly sized control group fell ill with COVID-19 during the trial. The efficacy rates from Pfizer and Moderna would have likely been different if the study had continued for a longer period of time, giving both the vaccinated and unvaccinated participants more chances to become infected.
Both trials only went on for a matter of months before the data was collected. They were also done during a time where there wasn't many worrisome virus variants circulating either. They reflect only the lowered risk of infection vaccinated people were exposed to and at a specific time and place. Vaccine effectiveness, a different metric, measures how well shots work on the general public. We don't have those numbers for coronavirus vaccines yet, but none of them have been around long enough to collect robust data on how well these new vaccines will protect people from future infections outside a controlled environment. It remains to be seen whether the COVID-19 vaccines will be as near perfect as, say, polio vaccines, which are more than 99% effective at preventing polio infection, or more like the annual flu shots, which are not as great at completely halting that disease. The plus side of even the less effective shots is that they can make a case of flu or any other disease like the coronavirus milder if they do not completely prevent infection. The vaccines will only be truly effective if they reach the majority of the world's population, but that will take a while. Emmanuel Samani, TV3 News.